When we chase the feeling, there can be a sacrifice to healing. Just think about this. What in your life sometimes makes you just feel good, but you know it's not right for you? And you could probably name a lot of things personally right now. If you were to think about that, what in your life maybe makes you feel good, but it's not right for you? And wherever your mind goes with that, just let it go there. Just think of drugs in general, not prescription medications, but drugs in general. There's a lot of hard drugs that can make you feel better, but are not good for you. Down a big bottle of alcohol or wine, or a case of beer, that might make you feel better temporarily. You're not going to feel very well here soon, but is that actually good for you? What is that doing? And you got to think about this when we chase the pain, when we chase the symptom, and we try to manage the symptom, which there's a lot of money in just managing your sickness. There's a lot of money in just managing your disease. That's why diabetes, you don't hear about drugs that reverse it. What do you hear about? You hear drugs about managing it. It's all about managing your sickness, managing your heart disease, your high blood pressure, your cholesterol. We need to manage it. Why? Because now you're a lifetime customer. And when we chase that feeling, again, the drug companies will play off of this because they know you want to feel better, and they know you want it quickly, and they know that as Americans, we are impatient and we live in a microwave. Quick, give it to me now. Give the food through a window as I drive up. They know that is our culture, and so they will play on that. But here's my challenge to you is, are you thinking long term? Are you playing the long game when it comes to your health? Chasing symptoms, chasing the feeling is a slippery slope and can actually delay healing. We see this all the time. With medications in general, I'll give you an example, the ADH drug. So there's an ADH drug that was found that delays bone healing in children. So this was first reported in the Journal of Pediatrics, and the researchers did a retrospective review of pediatric records of patients and x-ray images over 10 years. And so think about this. These are kids who were prescribed ADHD medications now 10 years later. And 10 years later, they're found to have lower bone density directly associated with the medication. Now, this is not a show about ADHD in general, but ADHD, as you know, is diagnosed based off of symptoms. It's not a blood test. It's not a serum test. They're not drilling a hole in the head to diagnose a chemical imbalance. The whole idea of chemical imbalance is actually theorized. It's a theory. You'd have to drill a hole into the head and actually get the cerebral spinal fluid and then test those chemicals there. And so these children are taking a medication, and then 10 years later found that, oops, your bone density has been weakened. And it's one example, but it's one example of many that when we take anything to chemically disrupt our body, there is going to be an effect. And those effects can actually delay the outcome that you're actually searching for.